Hello, I'm Dr. Altha Stewart, past president of the American Psychiatric Association and the African American representative on the DSM-5-TR Ethnoracial Equity and Inclusion Work Group. Over the years, APA members and others in the mental health community have raised concerns about how race, racism, and ethno-racial differences have been handled within the DSM. We heard them and took those things into consideration throughout the DSM-5-TR revision process. This process mirrored the way we built the DSM. We created a work group with experts in cultural psychiatry representing different professions across mental health. This working group then laid a framework for change that considered both the complexity of the DSM structure, as well as the literature used to inform and support the text. We were highly committed to the use of language that challenged the view that race and genetics are the same thing. For example, we use terms such as racialized or ethno-racial instead of racial to highlight that the construct of race is determined by cultural, social, legal, and political factors. We eliminated the use of terms such as minority to classify races of people, since it relegates the groups being discussed to an inferior or lesser than status. And with respect to the US and the world, these races of people, typically referred to as minorities, are increasingly becoming the larger proportion of the population. We also wanted to push towards promoting the use of gender-inclusive terminology and hence endorse the use of Latinx to replace Latino, Latina. We also reviewed and verified hundreds of articles to ensure that what's in the DSM is correct, up to date, and as informative as possible. And we offered disclaimers or clarifications whenever needed to provide the readers with background information, such as when higher prevalence rates of disorders are reported in the Black or Indigenous communities. We believe these efforts have addressed many of the concerns raised by our members and those of the mental health community. It makes the DSM stronger and provides us with momentum to keep race, ethnicity, and nationality at the forefront moving forward.